Good morning and good afternoon. Welcome to the webinar. We are thrilled that you've joined us. My name is Allison Avant. I am Senior Vice President for Client Development and Marketing at Clearway Health. We are thrilled to have our partners from Children's National Hospital who've joined us today, and we'll introduce them here in just a minute. But to get us started, just a couple of housekeeping notes. This session is being recorded. All of you are placed on mute, but we would love feedback and discussion and questions as we go through the webinar today. So you can use the Q&A part of your webinar, add those questions in, and then we will reserve time at the end to answer questions and to continue the conversation with our panelists. Today, we have team members from Children's National Hospital. Children's National Hospital is in Washington, D.C. You'll hear both Dr. Balmir and Dr. DiFazio talk about caring for the nation's sickest children, and we are grateful for their partnership in building a specialty pharmacy program for them. We began our partnership just last year in 2022 and are serving patients and their families in specialty care areas across the health system. So who you'll meet today, Dr. Eric Balmir is the Vice President and Chief Pharmacy Officer of Children's National Hospital. He served the health system there for the last 5.5 years and has worked in pharmacy and other health systems before his time in DC. And Eric, thank you for your partnership and for being here. Along with Eric, we have Dr. Marc DiFazio. Marc is the Vice President of Ambulatory Services at Children's National Hospital, and while he has been there for over a decade, has spent the last 5 years leading the ambulatory transformation and caring for children and their families across the health system. So thank you both. We are thrilled to have you here and would invite you to say a hello and a welcome as we get started with our first question. So as we jump in, really want to understand, Eric, we'll start with you, a little bit about your perspective on why Children's National Hospital decided to take this journey to create a specialty pharmacy program. I'll turn it over to you.
Thank you, Allison, for the question. And I guess before I answer, I really want to thank you and the Clearway team for putting this together for us. It's a pleasure and honor for us to be here to help share our views on this, and we're really thrilled and excited to be here. As far as this first question, I think it's a loaded one, but one that's pretty, I think if you're a pharmacist in this world, we all know pharmacy has grown to be so complex over the past decade. And when you want to think about specialty pharmacy on top, I mean, an organization like mine with over 50 contracted pharmacies to help serve us, really it becomes quite tricky. And our decision to move to a single, I don't want to say single entity, but basically a more focused one-stop shop type place, I think was our direction. Our patients were spread across the DMV area. And our physicians travel from clinic to clinic. And I think having a one steady person that can more or less help navigate the prescription flow really would be most beneficial to our patients and to the hospital.
That's really great perspective. And I think your geographic area is very unique. While you care for patients in a very urban care setting, it stretches far outside of DC, Metro DC.
Yeah, we are Maryland, we're Washington, DC, we're Virginia, and we have a host of patients across the nation. We even have international footprint, Allison. So we're worldwide.
It's incredible. I know there's a lot of focus, and we'll talk a bit about some of the innovation that Children's National Hospital is doing. And Marc, from your perspective, leading clinical and ambulatory transformation, you've talked a lot about the impact, not just on patients, but also on staff in wanting to embark on this journey. So tell us a little bit about what that means to you.
Thanks, Allison. Yeah, and thank you. I would echo Dr. Balmir's sentiments as far as this relationship with your organization. It's been fantastic, and we really appreciate the partnership in the project. And I just want to make sure that everybody knows that Dr. Balmir is the true brainchild and person with vision here. He's done a phenomenal job for us here at Children's National. So yes, and Allison, to your point, there is a lot of work that's being done in children's, just like everywhere, focusing on access to care and facilitating throughput and patient experience, compliance with meds leading to better health outcomes. All those things are certainly a priority, but we all know that it's not just the clinician staff, as everyone knows on this call, it's the pharmacy staff, it's the frontline staff. We're all experiencing a lot of additional stressors given what the last 36 months have really entailed. And so, yes, anything that we can do to facilitate the work of the frontline staff, streamline it, take some of that burden off them, perhaps leads to better, again, sort of engagement for the staff, better staff retention, all those things. So it's really very, very critical that any initiative like this be considered. So,
thank you for that. As we think about the next question, you both talked about creating this cohesive strategy for pharmacy to really serve the entire health system, its patients, its staff, the families of patients, the community. And the vision that you've had and how you do that has been incredible to witness. And one of the things that you have shared consistently with us is creating an extension of pharmacy into the health system and finding a partner to help you do that. And so we'd love just to hear a little bit of perspective on why you chose a specialty pharmacy partner to build the program and why it was important to you. It was a journey, Eric, to say the least. So would love to hear your perspective on why a partner and what was important to you.
Sure. Thank you, Allison. I think simply we needed experts. You know, the landscape of specialty pharmacy, again, is changing, and these manufacturer blocking and the insurance company denials. I think, you know, and to Dr. DiFazio's point, the last 36 months has brought us such a bit of additional stresses with being staff. We lose, or we've lost subject matter experts in the field of just prior authorization. And what that did for us, it shifted the work to other members of the clinics and the hospital. And I think that decision in itself, pharmacy is in a right position to really assist the healthcare providers in really taking those 30, 40-minute phone calls out of their workload just to talk to insurance to get a note that we can just easily pull ourselves, really unloading that burden. And I think selecting the right partner, that in itself is a webinar in its own. I've been on this journey for almost 3 years. And I think the clue there, it's really data, understanding who can bring it, who can decipher, interpret, and really give you the best projections, not just financially, but clinically. I think that balance is so important, and choosing a partner that really cares, as financial, clinical, really having an equal arm was really, really important to me, or to us.
Yeah, thank you for sharing that. You have been an advocate in talking about the importance, not just clinically, but also operationally and financially, and really holding each of those metrics at levels that we understand what's important to you, so that we're supporting you to reach and to meet those goals. So appreciate that. Dr. DiFazio, your thoughts on choosing to partner and what was important to you as a clinician?
yeah, I mean, I'm sure everybody receives, Becker's in their inbox. I mean, this is a time for all of us to make sure that we're being as efficient as possible and, revenue responsible. And so that, I think, factored into Dr. Balmir's thought process as well. But I would concur, Allison. I think that, you know, the clear evidence of improvements in clinical outcomes, just to put my clinical lens on, and facilitating the work of the clinician. And so we're all working on increasing clinician productivity, again, and access to care. If my APPs or MDs are slowed down by this work, you know, authorizations are not obtained efficiently enough, then, and it requires their hand in that work. Again, that's work that takes them away from the front line and patient engagement. So really, I think that demonstration, Allison, of what was done in past and previous centers really was very, very convincing from my standpoint.
Yeah, that's great. One of the things that I've heard Mark, you and others talk about is the intentional focus that Children's National Hospital has on creating this child-centered vision and how that impacts the delivery of care for you, for your care team, for the providers. Will you talk a little bit about that concept of child-centered vision and the way that the specialty pharmacy program helps to support that?
Yeah, everybody probably on this call, I would assume, takes care of complex patients, and in our patient population, especially those that come through some of these specialty services, are very, very complex. Multiple medication needs, multiple stops along the way throughout the hospital system or outpatient resources. And anything that we can do to facilitate distribution of their medications, and not just medications, but the durable medical equipment that goes along with the receipt of that medication, for instance, insulin and insulin supplies, that is streamlining for these families. And for some of our families, they are challenged, with time constraints, and maybe working a couple jobs. You can build that social construct as far as how these families might be constrained and really pressured to sort of get through their visits and get this work done for their kids, so they can get back to the care of their other children or get back to work, et cetera. So that to me, again, we preserve the family, the caretaker, and that's good for the child as well. And so getting these kids in on a regular basis, and then not being able to, or not saying to them, well, here's your prescription, go somewhere else for that medication, or you have to add a stop. So centralizing this is really pretty critical for these families, in my estimation.
Allison, just to piggyback off Dr. DiFazio, the level of frustration that our families, what they go through just to navigate healthcare, right. Just to get, the reality of our organization, sometimes they have to wait months just to see a provider. So you add that, they finally get to the door, and now we have to wait weeks to get the prescription, or whatever that looks like, whatever that time frame is. I think it just compounds this frustration that we would never, you don't feel unless you're in it. And I think that this program, not only will we assure we got prescription adherence, but hey, little Johnny's scheduled for his next visit, he needs a refill, and we don't see little Johnny coming in for the next visit. It also helps increase the compliance to the visits in itself. So all around there's support. And I think having the pharmacy personnel at the clinic, elbow to elbow with the clinicians, really adds that value in making sure that we reduce the level of frustration that these families go through.
That's incredible perspective. Given every challenge to access care, our focus should intentionally and always be how to remove obstacles to help enable and ensure that access. So I think that perspective has really centered all of the initiatives that we've began building together. And even in this conversation, you've talked about some of the goals that are important to you in helping to improve access to care, to create a more intentional and easy way of receiving care across the health system. Are there other goals that you and other executive leaders across Children's National Hospital have in sight with the specialty pharmacy program?
I'd like to go first.
Yes, please.
You can go first.
So we started with 5 liaisons. I mean, that's what we have today. But news travels fast. I mean, the work, the good work that has been done in the last few months by these 5 is just unmeasurable. Now we have requests, email after email. Eric, when can I get a liaison? How can we do this? How can we spread the love? I mean, it's not even, I think people just see the benefit just all around. And then primary, the child center focus that you mentioned earlier is at the key. People are getting through the door and we're keeping them healthy.
Allison, the one thing I would say to anybody who is a clinician or supervises clinicians, excuse me, to sort of riff on what Eric just said, you know, in this moment where a lot of us are sort of resource challenged, we'll say, to turn around and say to a clinician, I'm going to support your work with a pharmacy liaison who has these skill sets, this area of expertise, and she's going to basically make your day more streamlined, take a little bit of pressure off here so you can go again care for patients. That sort of exchange is absolutely invaluable, and this partnership between, you know, the medical staff and or the clinical staff and the pharmacy staff is just so important. And so I would say that that's a really important goal for me anyway. The second point is to Eric's description of, you know, compliance and follow-up appointments. As staffing levels are challenged, as we transition out of the pandemic and volumes go up and access goes down, you know, there's a safety risk. And so ambulatory is just as prone to serious safety events. A lot of those, of course, have to do with medication dosing errors, et cetera, transcription errors, whatever. This mechanism sort of facilitates that focus on safety. And so if we can reduce that one med error with all the clinical consequences, the consequences for the child that can be pronounced, obviously. And then there's an ROI on that too, right? There's not necessarily a repercussion of those, a legal repercussion of those types of injuries. So again, those are 2 things that I might add to what we've already talked about before.
Those are great. You know, one of the things, Mark, that you talked about really is this concept of clinician burden. And we talk about it often, I think very often tied to technology and the cumbersome things that are required of clinicians to do their work. And when you bring a service that requires really no additional burden from a clinician, but rather provide support, creates an incredible satisfaction level for the clinicians that to your point is wildly important. So I appreciate that, as well as the patient perspective. Eric, you talked about the raising of the hands and asking for help, wanting to add more pharmacy patient liaison, more strategic thought. What has this program created already in only a few short months? What has this program created opportunities for you?
I think a few things. One, the awareness. I think people really did not understand the amount of time that it took just to get prescription authorizations through the process. I think we also, what we learned through this process, as we went through all the different ambulatory spaces, we found that there were a little bit of variability in each area. Different people did it, differently. And then also with the staff vacancy issue, you may have lost the subject matter expert in one area, and now the work had to fall back to someone else. And maybe that transfer of knowledge was not as clear. So what that uncovered for us is the disparities amongst the different areas for the same process. So I think for one, it gave us an opportunity to standardize the process. 2, I think as far as being most efficient, you learn best practice. So GI, gastrointestinal, is doing it one way, and you go to oncology or you go to endocrine, you kind of bounce best practices because we're calling the same insurances. You almost have this you leverage. You're leveraging, and then they get the call from the same type. It's really it's exponential in the reward that and the turnaround of information and output that we get from this.
That's great. And Mark, you've talked about beyond process, awareness, and consistency from a clinical perspective. You've talked about opportunities for, you mentioned earlier, decreased safety events and prescription omission numbers going down, and the prior authorization times decreasing from 30 days to 2 to 3 days. Talk about the clinical impact that those things have for your patients.
Yeah, it's wildly impactful, Allison, and that is a pain point that I hear again and again for in any of our sort of clinical sites. For instance, in neurology, for ACTH approval for infantile spasm, as an example, we just we're at one of our PAs is ending up doing a lot of that work because we're not resourced to do that pre-authorization in any other sort of format, Eric. So maybe you can put me next on the list in neurology. So, but I think that taking that burden off, gaining the trust of the clinicians, and then again, like I said, having the clinicians just that much more engaged with families. So we know those, any interruption in that communication or contact or relationship with the family diminishes the potential for improved outcomes clinically. And that's pretty well shown from, for instance, like the patient portal literature. So making sure that clinician stays sort of engaged with her patient panel, and really we're, again, I like I said, as a clinician, come at this from that standpoint that the better my clinicians function, the better the outcomes of the families, certainly. So,
thank you.
Allison, I think also to add to that, the callbacks. So once the patients receive the prescription, that there's a phone call. Well, how's it going? And did you receive it? I think just the closing the loop piece is also a very big part of this. That frankly, to measure that in itself just guarantees the adherence going from 60 to 90% with our patients. I think is key, and I don't know what healthcare wouldn't be happy with those types of results. And I think when you think about from an insurance perspective, on their end, they're better off. A compliant patient basically will use less insurance in the long run. And so those things I think are really, really exciting as we continue to work and we measure our outcomes.
Mm. That's great. You teed up the next question really well as we continue the work. Yeah, thank you, and measure outcomes. But the question is what's next? And as you talk about what's next, you've alluded, Eric, to more than 3 years of being on this journey, having just recently gone live with the program in the fall. But as you talk about what's next, will you also talk about the timing of the commitment and partnership implementation to really help to share the timing of how quickly you've been able to achieve such incredible results and outcomes already with this program?
Sure. I think that, what's next? There's so many things that's next. We have 5. I think we just had our 6th liaison start last week. And they're up and running already in a week's time, which is another factor of why this is so important, having you as a partner. But in essence, in order to really put this in full swing, I need about 20. I need between 17 and 20 of these liaisons so I can position them in all the ambulatory clinics across all 3 jurisdictions here. So what's next for me is really planning that expansion in a systematic way and showing the return on investment to defend the adding of these liaisons, 1, and 2, I think opening our own doors, opening our own pharmacies. I mean, we're planning for 1, but in reality, the numbers are showing in such a way that they're so favorable, we may be planning for 2, 1 in Maryland and 1 in DC, or Maryland and Virginia. So the way we're set up with our outpatient buildings, we really have an opportunity to really secure and really close the loop with our prescription program. Imagine just leaving Dr. DiFazio's office and walking out and getting your prescription right then and there, or already a phone call, it's in the mail, it'll arrive to you this afternoon. I mean, that's the type of thing that we're really striving for. So lots of those things. And then, of course, expanding the program, within the hospital itself and seeing what a retail store can do for us.
Eric, those are all great points. And Allison, you mentioned the rapidity of this, and this has been a really, really short runway for Dr. Balmir to sort of accomplish these, along with your guidance and assistance. So first of all, that's been amazing, and oftentimes we are promised things. This new IT solution is coming, whatever. This was real, and while we're looking to realize additional financial gains in the future from some of Eric's work, this is a real benefit today, after months, that is being reported to me as the ambulatory lead by some of my chief contrarians. And I've got a few of those, and I've got some real notable ones that Eric knows who I'm talking about. But these are people who, if I can win these people over with their engagement and their enthusiasm, that's remarkable. They're seeing it on the front lines and for their clinicians and patients. So I just want to echo also, Eric, yes, 100%. I would vote for Maryland for the pharmacy, but I would say maybe Virginia as well. But yeah, that would be the next sort of value add here, that there's the financial gains of having an in-house pharmacy, but also the clear convenience and compliance gains by having an in-house pharmacy as well.
That's great. I want to take that a step further, Mark. You talked about the legal and compliance gains, and so much of this ties back to the ability to create increased access and improved revenue based on that 340B regulation. And, Eric, you've talked so often about the intent and purpose and the way that you are living into the purpose of the 340B regulation, the way that it creates improved access, reinvest dollars back into the community to continue to serve patients and their families. And that's something we can't overlook in this conversation, because while the work is wildly important, there are a lot of regulations that we're required to work within. So would love your thoughts and perspective on what some of those opportunities and challenges have been.
I think more on the opportunities before challenges. I want to talk about the copay assistance that we're able to provide with some of those dollars. I want to talk about the staffing opportunities that we use. Today, I now have pharmacists doing the medication reconciliation at the point of entry in our ER. That would not be possible without this program. So we're able to strategically staff people for ambulatory needs. So medication reconciliation sort of touches both worlds. That continuum of care really is impacted. And I know we touched on medication safety. Pediatrics is a very vulnerable population, and we are laser focused on safety, and it's at all angles. And I think having the dedicated clinicians at that point of entry is one of those key elements. And also today, patients, they pharmacy hop. They hop around, and to Marc DiFazio's point, that the chance of transcription errors just from that hop is so high. And with this type of program, prescription retention is one piece for financial, but even bigger, really the reducing the risk of the transcription errors is huge. From a challenge perspective, I think, we're bought in, the ambulatory team's bought in, but hospitals like us, we have payer clearance teams, and it's really socializing the program in a way, well, hey, listen, we're here to work together. I think really learning best practices and socializing that is something that we continue to work with our payer clearance team. I don't know if I would call it challenge, but definitely it's something that I would really, pay attention to as we go into and we expand the program, is really managing how we work collaboratively together.
That's great. And I think touches on some of the key stakeholders that we talk so often about, ensuring that it's not just a pharmacy program. It reaches and stretches and touches across the health system within different departments.
Yeah. Yeah, Allison, Eric sort of, if I could just emphasize that point as well, that Eric really has educated me up on that this is not just pharmacy. This is a clear integrated sort of practice model where the pharmacist is hand in glove, standing right next to the clinician and facilitating care. So that's and I would say, of course, Eric's my favorite pharmacist, but this is something for the pharmacists on the call. Use him as a resource. I'm sure he would love to answer any questions. He's done the same thing on the inpatient side as well that I'm well aware of. So a lot of good work.
Thanks, Mark.
Thank you, Mark. With that, for the folks that are on, whether they are pharmacists, executive leaders, in finance and other parts of organizations, what advice would you give to another hospital or health system who is considering expanding, strengthening, or even starting their specialty pharmacy journey?
That's a good question, Allison. I think for me, one of the things that has really led to our quick success is how we honed in on the data. I mean, we've been on the journey for quite some time, and it took us a lot of time to get the data right. And I think honing in on that is one of the key things, and you got to get it right from the beginning. All of that, mapping out also the opportunities. When you think about it, we started with 5, now we're up to 6, and you heard me earlier, I want 20, right? So really mapping that out. I think if I knew what I knew now, I probably would have went for 10 first. And I think, if anyone is thinking about it now, really the ROI is strong. And working that data to really get that demonstration is key.
Eric, I would agree with all that. Aside from the ROI, everyone, from a financial standpoint, I think that's fairly clear here. Like we've already said, we've got all the clinical rationale. The things that I would say to the executive leadership or senior leadership would be, map your current state, know where the gaps are, and just listen to your clinicians as far as things like pre-authorizations or work being done that is not necessarily fulfilling top of license responsibilities. And then safety issues, it takes really one safety or issue or error to really frustrate and concern everyone. And if it's a safety issue related to medication that is potentially preventable, that's another selling point. And then the last thing, again, from a med staff and clinician staff, where there may be more burnout, this is a means of giving back and getting them to participate in a real value-added program, as opposed to just saying, go work harder, be more diligent, document more in the EHR. This is a real benefit to, again, the entire team. So those are the things that I probably would emphasize.
Thank you for that. We have a lot of questions that have come in. There's been a lot of great great thoughts shared that I think have provoked a lot of other thoughts and questions. I'll first pause to say thank you, Eric and Mark, for sharing thoughts. And would love to share a couple of questions from the group today. I'll start with this one because I think it's a jumping off point, Mark, from where you just were, which is really around change management and communication to key stakeholders. So when it's Eric, the payer clearance team, where there's going to be an intersection of roles and responsibilities, Mark, when it's helping providers to understand the referral flow and the change management. How did that process work for you? Were there obstacles? If so, how did you overcome them? Thank you for the question.
Eric, go ahead.
I think, yes, of course, the way our processes work here, we both, Mark and I, happen to work for an amazing chief operating officer. So convincing her was easy, but convincing the rest of the C-suite, well, that's where some of the challenges come. I think the 340B business, I mean, you really have to take your time, after a glass of wine maybe, or a big cup of coffee to absorb and really understand it. What do you mean you're getting the drug and you have to pay the drug and you have to give the drug back? And, the amount of questions that we had to, that I had to respond and just educate them about 340B, that in itself was a challenge. Intersection with payer clearance. Well, I don't know any pharmacy in the US that doesn't have their challenges, because they have one focus and we have another. And I think in the specialty pharmacy space, the stakes are too high. They're too high. You can't risk having someone with no prior auth coming to the clinic. You can lose a $40,000 script, just because the prior authorization was not in place. And again, when we looked into this, oh my gosh, we were really shocked with the amount of free drug that we were dispensing or we were using at the clinics.
Yeah, and Eric, I would again echo all of that. I think that overcoming any sort of reluctance on the part of the clinician is, I think, relatively easily offset in this circumstance, everyone, by saying there's a relatively short turnaround time for us to engage with you and have these pharmacy liaisons sort of show up and begin to do that work. That's not like millions of dollars through the door. But again, it's real tangible assistance to being offered, and that's what we all need. We're all resource challenges with staffing difficulties around the country. So I think that was the way that it was most readily overcome. And it's having seen it happen with, I keep getting back to my contrarians, but having seen it happen successfully with those two individuals in particular, and now having this outpouring of, hey, Eric, can you help me in spina bifida clinic or neurology? That is telling as well. So I think that you guys could see relatively quick turnarounds on that.
What was interesting, Mark, when those contrarians now are making space in a very tight clinic. No, we have to have space.
Oh my God.
For the liaison. I mean, they're telling me now, which is right. Wow. I mean, that was victory for me. So. Yeah. A lot to be said with that.
Yeah, most hospital systems have an ample amount of space, and there's no restrictions on space usage, right? And yeah, that's usually contested here at Children's quite tightly. So yeah, it's a great point. Great point.
I do love that story, and I will say and commend and thank you both for the partnership in helping to ensure that communication happens in the right ways, because it requires the collaboration, and we're really grateful for that. Another question that's come in, this one is about limited distribution drugs. So I'm gonna give a little bit of background, Eric, and place this one with you. You all have talked a lot about the ways that Clearway Health provides the staff and the partners embedded within clinics to serve patients as an extension of your care team. Behind the scenes, the not patient-facing work that happens is oftentimes helping to gain access to drugs that otherwise may be difficult to obtain, to help to partner or negotiate with payers to support. And so this question is really more of that behind the scenes kind of work that happens, and talks about how, Eric, you're accessing limited distribution drugs that you wouldn't otherwise or have not previously had access to from different manufacturers. So would love for you to share your thoughts on that.
Sure. I think limited distribution drugs are one of the toughest processes to really follow. And if you can imagine, for us, a complex patient can walk out with 22 drugs, 22 prescriptions, and 5 go here, 2 go there. Oh, and by the way, these 2 have to go to Oregon, or this one has to go to California. You could imagine the issues around just navigating those waters. Children's National having access to limited distribution drugs allows us to centralize the dispense, all 25, as much as possible. Not yet, we're not there yet, but as much as possible to be dispensed from one location. And I don't know, I hope that was clear. It's just the back end work is hours on end. And if you don't have one of these liaisons, the person that's doing that work, they're inundated with just chasing pharmacies and making sure we got the prescription at the right place.
Thank you for that. There are a handful of questions that just talk about logistics. Where do the people come from? How do we hire and place them? People are very excited for you that you're opening your own pharmacy. So there's a lot of excitement coming in for that. So would just invite you to share a couple of parting thoughts as we wrap up on what this has meant, and certainly the resource that you continue to be to both to Children's National and to the pharmacy industry as a whole.
I think our future is bright. We just, it's sort of like that onion, and we've unpeeled, a few layers, and there's a few more to go. And so far, what we've uncovered has been amazing, and it can only get better as we continue to peel those back. Clearway, I can only tell you, I have been wowed from the beginning, from their recruitment process, their onboarding process, hand-holding, access to me, access to my teams, access to the physicians, the philosophy, our mission, our vision-driven similarities. I can't say enough that we picked the right partner. And as one of the leading children's hospitals in the nation, we made the right choice. And I can't, again, thank you for that.
Thank you.
Yeah, if I could just finish up, I would, I think it's clear to me, Allison, that the origin of the organization, Clearway, and where you came from, I think has sort of driven your vision and your mission. It's fairly clear to me that you guys came from a clinical background, a hospital-based background, and that is, for me, was much appreciated. You sort of understood our current state, who we are, what our mission is, and also understood sort of the fiscal realities of the challenges that hospitals like ours face. So that was amazing. Like I said, I look forward to working with you guys going forward. Any success here is a success for the families and the staff of children. So thank you so much for the partnership.
Well, we echo the thanks. We are grateful for your partnership and for the ability to be an extension of you and to the communities that you serve. And just to close on values that are not ours, but they're Children's National, ones that we carry forward as an extension of the work that we do in partnership. You talk often about compassion, commitment, and connection. And so for those 3 reasons, we're grateful for you and for the partnership and the work that we're able to do together. So Eric, Mark, grateful for your time today. Thank you.
Thank you.
All right, thanks, everybody.
Thanks, everybody. Take care.